Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about fluids calculation, maintenance fluids by using the 4 is to 2 is to 1 rule. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the topic. The 4 is to 2 is to 1 rule. This is a weight-based calculation used to estimate hourly maintenance IV fluids, especially in pediatrics, but it is also helpful for quick adult estimates as well. Maintenance fluid usually replaces daily ongoing losses, which is through urine, insensible losses through skin and lungs, and basic metabolic needs. First, considering urine, for example, a child produces 500 ml of urine per day. Maintenance fluid replaces this lost water to prevent dehydration. Next is insensible losses through skin and lungs. For example, a febrile child loses water through sweating and rapid breathing. Maintenance fluids replaces these unseen losses. Next comes basic metabolic needs. For example, even a resting child needs fluids to support cell function, nutrient transport, and blood volume. Maintenance fluids provide all of this. In 4 is to 2 is to 1 rule, the formula is usually calculated based on body weight and the fluid rate. For the first 10 kilograms, the fluid rate will be 4 ml per kilogram per hour. And for next 10 kilograms, that is from 11 to 20 kilogram, it will be 2 ml per kilogram per hour. And then onwards, for each kilogram more than 20 kg, it will be 1 ml per kilogram per hour. It is the standard formula used to determine the hourly maintenance fluid rate for a patient based on their weight in kilograms. Next, let's do a fluid calculation using the 4 is to 2 is to 1 rule. Example, a child weighs 18 kilogram. What is the correct maintenance fluid rate using the 4 is to 2 is to 1 rule? Here we go step by step using the 4 is to 2 is to 1 rule. For first 10 kilogram, using the 4 is to 2 is to 1 rule, the fluid rate will be 4 ml per kilogram per hour, and hence we multiply 10 into 4, which gives 40 ml per hour. Then, for remaining 8 kilogram, based on the rule, the fluid rate will be 2 ml per kg per hour, and hence we multiply 8 into 2, which gives 16 ml per hour. And hence, the total maintenance fluid will be 40 plus 16, which gives 56 ml per hour. Next example, a child weighs 30 kilogram. What is the correct maintenance fluid rate using the 4 is to 2 is to 1 rule? Here we go step by step using the rule. For first 10 kilogram using the formula, the fluid rate will be 4 ml per kilogram per hour, and hence 10 multiplied by 4 will give 40 ml per hour. And for next 10 kilogram using the rule, the fluid rate will be 2 ml per kilogram per hour unless it is 20 kilogram, and hence we multiply 10 by 2, which gives 20 ml per hour. And for the remaining 10 kilogram, using the rule, the fluid rate will be 1 ml per kilogram per hour for each kilogram, and hence 10 multiplied by 1, which will give 10 ml per hour. So altogether, the maintenance fluid will be 40 plus 20 plus 10, which gives 70 ml per hour. Here comes few questions for your practice. First question, a child weighs 22 kilogram. What is the correct maintenance IV fluid rate? And next question is, a child weighs 31 kilogram. What is the correct maintenance IV fluid rate? You can do the calculation and mention the answers in the comment box. Next comes the uses of the 4 is to 2 is to 1 rule. It is used for calculating hourly maintenance IV fluid requirements. It is most commonly used for pediatric patients. It is also used for hospitalized patients who are NPO. It is used for postoperative patients needing maintenance fluids, also for patients who are unable to take adequate oral fluids. This is also used for short-term fluid planning in stable patients who are not in shock. This rule also helps steps to estimate fluids needed to replace normal daily losses, which includes urine plus insensible losses. So here we go with the fluid calculation using the 4:2:1 rule. If you find this video useful, please like it, share it, and subscribe it. And do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.